Everybody. I'm Terry Helton. I'm a registered nurse and the chair for the Ventura County Coalition for Compassionate Care. Just a little brief history and a welcome to you. And thank you for being here. Well, the history is that advanced care planning has been in a process since 1992, basically. And we've struggled with that education for people to have advanced care planning, to have advanced care directives. And then in 2008, the state of California followed the lead of Oregon with having the law passed for a physician orders for life-sustaining treatment at POLST. And we've been working with that since 2008. The Coalition for Compassionate Care has been in existence, the local one, since about 2013. And we have been working in this county to educate the public on POLST and advanced care planning in general, the healthcare community, and have been making slow steps forward. What we have found interesting, just to give us a little brief synopsis of this and why we're working so hard at it, is even after all this time, there are actual healthcare people, physicians, and other people in the healthcare system who do not really know what a POLST is. So as we move forward, even with this presentation, one of the underlying factors we want to add is that the local coalition, our coalition, is here to help educate and support the healthcare community and what a POLST is, how to present it, how to support it, and also help the community with that. We understand that there is a lot on every healthcare provider's plate and that adding something else is difficult. But in the end, we are hoping to make this much simpler for our medical community and for the public. So in stating all of that, the coalition is looking for people, and I'm going to put this out there ahead of time because Carlo's going to take most of our time. I'm going to put it out there ahead of time. We are looking for people who would be willing to be active in this coalition to help with advanced care planning education and to help support the idea of having an electronic POLST registry. Saying that, we're going to give most of the time to Dr. Carlo Reyes. He's a pediatrician and an emergency room doctor for Los Robles Hospital. He is dedicated to this idea of having an electronic POLST registry, and we've worked together for a few years on this. And I am very honored to call him friend, and I just will allow you to present, Carlo.
Thanks, Terry. I appreciate it. So thank you all for coming. I think I've met most, if not all of you at some point over this journey about, regarding POLST and furthering the initiative in Ventura County. Some of you have been around ever since we applied for the pilot study that was started by the California Healthcare Foundation. That's going on about 5 years ago, I believe, roughly. And that whole process, although we didn't get that pilot, it actually allowed us to grow and eventually launch an electronic POLST registry about a year and a half ago. Interestingly, there was a lot of positive traction both within Ventura County and within the state of California, and actually nationally, when key leaders were kind of watching what we were doing and what our vision and hope was for in electronic POLST, to the extent that we are actively working with the California Coalition in launching an electronic POLST registry. Their approach has changed because their pilot several years ago really identified a lot of key issues with trying to launch an electronic POLST. So I'm not going to get into that too much. I'm actually going to focus on really the opportunity that we have in Ventura County to be the first county in California to launch an electronic POLST that is consistent with the vision of the California Coalition and the California Emergency Medical Services Agency. So we've been working with the leadership with Ventura County EMS and the California Coalition. I've been in communications with Judy Thomas as well. about how we can do this. So let me take a step back and let you know that there is funding that was earmarked for launching an electronic pulse registry in California to the tune of about $10 million. That $10 million gets kind of cut up quite a lot when we talk about what a launch would look like. And so let's talk about what that launch would look like. So the vision is for California EMS to be the leader and implementer and kind of caretaker of electronic POLST, while California Coalition is the caretaker of the contents and education of POLST. What that means is that there's dual leadership in the launch of electronic POLST in California. What the pilot identified was that counties are doing it differently, some much more effective, some less effective, but at the same time, those stakeholders in each county, in each region of California, have enough traction that they want to build on that traction. What that means is that they want to allow counties to do it their way, as long as the long-term vision is that all the counties connect into a single source repository in the state of California, okay? So that means counties that are doing it right get to keep doing it. Counties get to learn that aren't doing it right, get to learn and redo, and then eventually get it right in their county. Counties that are well ahead in launching electronic POLST are still well ahead in launching it because we get to use what we're using. The unique thing about Ventura County is that we have our own electronic POLST. It was launched about 1.5 years ago. It is been vetted by National POLST, and it is approved basically by the California Coalition to launch an electronic, our version of the electronic POLST. This implementation dollars that's earmarked is going to be used to connect all repositories into that single source and to build a single source repository. So we have an opportunity to be ahead of the game, to launch something before anyone else, any other region in California can launch it, and we could actually be leaders in what electronic POLST in California looks like. So that's kind of the exciting part. Not to mention the fact that there'll be funding for our local EMS to implement and launch, and some of that funding may kind of trickle down to some of the key players in hospitals and facilities. We don't know what that looks like yet, but over the next 6 to 12 months, we'll find out how that gets earmarked. And then finally, there's going to be annual funding for the continuation and maintenance of electronic POLST. Okay, so that's kind of like the environment that we're in terms of the support for electronic POLST, and how we believe at the Ventura County Coalition, we're really well ahead of the game. So now we need to go back to our grassroots, back to the time when we launched that pilot. We had 35 or 40 entities signing letters supporting electronic POLST in Ventura County. We need to get back to those grassroots and do it all over again, okay? So I am now going to share my screen, and I'm going to show you some exciting things that we're working on at my hospital that could actually be a benefit to all the facilities in Ventura County. Hold on one second. All right. Can you all see my screen? My PowerPoint. Okay. So as some of you may know, Los Robles has started a training, internal medicine residency training program. Okay, it's our first year. In the coming years, there'll be more training programs coming, like radiology, anesthesiology, surgery, etc., emergency medicine. But the first training program that we opened up this past year was internal medicine. So the graduate medical education division of HCA and Los Robles is very interested in research opportunity. As it turns out, launching something like this is an incredible opportunity to do research. So I pitched this research opportunity with the leadership at Los Robles and HCA, and we are working towards launching a multi-center study regarding ePOLST registries. This will be a very unique study because a lot of the functionality in our ePOLST registry is actually unique. And so it's an opportunity where we could really study the effect of ePOLST registries on implementation, utilization, and adherence of POLST through, and how an e-pulse registry can improve all of that. So we're in the process of building the objectives right now. We hope to have all these objectives completed and then approved by Los Robles probably in the next 2 to 3 months. We have internal medicine residents ready to help us research it, crunch the numbers. So there's a lot of interest within Los Robles to launch this. I asked a very specific question. I said, can we have the hospitals, all the hospitals of Ventura County participating and being sites for this study? And we're able to do that. So I'm about to approach every hospital to be, every emergency department and palliative care department in every hospital in Ventura County to participate in this multi-center study. This would be the first type of study in the nation, okay? And the most important thing is that this is the vision of the California Coalition, okay? It's not, POLST should not be in one hospital. It shouldn't be in one EMR. It shouldn't be only accessible to those that have access to a particular platform. It needs to be accessible everywhere. Emergency medical services, skilled nursing facilities, hospice agencies, patients and family members, and hospitals. And so that is the study. And it, to my knowledge, this could be the first study ever on electronic POLST studying that specifically, a community-wide launch involving all the key stakeholders using the same platform, okay? So exciting news, very excited about that. Probably went through all the slides and just talking about it. So this study is going to be focusing on launching this platform in a certain way. We've got to implement it in a way. We've talked about how this implementation is going to work. We've reviewed, I've reviewed studies on electronic POLST. You know, there's more evolving studies, but I did query the HCA, which is the entity that owns Los Robles. As you probably all know, HCA has around probably 186 hospitals over the country. They're the largest residency training institution in the country as well, by the way. And so they have a lot of active research going on. And I queried our Far West Division research coordinator, is there any studies like this in HCA? And they said, no, not one, not in any of the 186 hospitals. So it gives you a sense for how unique this study is, okay? So the key stakeholders in the implementation are going to be the hospital-based physicians, you know, like myself, an ED physician, palliative care specialists, hospitalists, intensivists. And then it's going to be really going to be driven by palliative care departments in those hospitals in terms of part of the implementation. You know, each hospital has existing POLST forms. It needs to be uploaded into an existing POLST registry, so that registry becomes the single source repository, okay? And then finally, there's the key stakeholders outside of the hospital. You know, outpatient facilities and agencies, which I've mentioned, are going to be key players in the utilization of electronic POLST. There's already good workflows for the sharing of POLST. It's done through paper primarily. It's a good workflow. It's not a great workflow. The whole purpose, one of the key questions of the research study is to see if an electronic POLST improves upon those workflows, improves the adoption and use, and reduces those times when that paper POLST does not get shared in emergencies, right? That's the kind of like why electronic POLST is viewed as a more reliable means, okay? And then finally, EMS. So during those 911 calls, we need our EMS providers to quickly have a workflow for looking up a POLST in an emergency in the electronic platform, and then using that form to guide their care that's delivered to the patient. That's then, you know, transmitted to the ER physicians, critical care doctors, and intensivists and hospitalists, so that we stay in line with whatever that POLST says. Okay. Oh, so this implementation takes time. Okay, and the reason being is that there's several facets to it. One is populating the POLST. So by populating the POLST, we need to engage our hospitals, our skilled nursing facilities, our palliative care departments, et cetera. Okay, the ones that actually create POLST need to actually change those workflows, modify them so when they're creating it, it's going into the electronic POLST repository. So we've talked about what those workflows are going to look like. I've engaged with 2 hospitals, actually 3 hospitals in Ventura County already about what that's going to look like. So we're working on workflows to get that uploading of the paper POLST and starting to build electronic POLST in the repository. And that's happening probably over the next 2 to 3 months, okay? The next phase is moving to the outpatient setting and also reaching out to skilled nursing facilities, hospice agencies, all those entities that also touch POLST, use POLST, and create POLST. So the same process is gonna work there. The idea is that all the entities that either create or look at POLST need to start treating the electronic POLST repository as the single source. Okay, that's the place to look. Okay, and then the final step is going to be training EMS providers and emergency physicians to look up POLST. Okay, so that can't happen until the POLST repository is actually populated sufficiently. So we have a rollout implementation plan, and this has been in discussion with us, with the ER physicians and leadership in all the ER departments, and also the director of Ventura County EMS, Daniel Shepard, about we need to show that readiness, or each hospital needs to show that readiness. And then once the hospital shows that level of readiness, then the Ventura County EMS providers will be trained to look up POLST whenever they bring a patient in to the hospital, instead of looking for a paper POLST. Or actually, I should correct that. Paper POLST will be part of the gradual transition. So paper POLST will always be looked for, but electronic POLST will be treated as single source over time. Okay. So I'm talking with Daniel Shepard about how that's going to work out, how that EMS workflow is going to look. So as you can see, this timeline is over 6 months, maybe 8 to 9 months, just to get everyone launched into the electronic repository. Once all that's done, then, third quarter, second to third quarter of next year, that's actually when the study starts. When we go live, and then everyone's ready, everyone's trained, all the POLST are in the repository, and we're ready to go. Okay. That should coincide with the rollout plan for the state of California as to how that's going to look. And if you think about it, if we could do all this work in the next 6 months, we'll probably be the first county in the state of California that'll be that far along when the state of California starts looking at a statewide launch. Okay, so the technical team, Healthy Med Record, which I'm the CEO for, is going to be working directly with the technical teams and that's leading the rollout for the single source repository build and for connecting our registry directly into the single source. And that's going to be over the course of the coming 6 to 9 months as well. So while all this is happening, the technical team will be working with the state of California. Okay. All right. So I think that's all I have in terms of the foundation. Okay. Lots of exciting things happening between finally getting some funding, to the opportunity for research, and then working with the state of California. Really very exciting things happening. I'm going to now share my access to the platform. So give me 1 second. Okay, can you all see access to the platform in accordance? Just someone kind of nod and say yes so I can see. Okay. All right. So this is the platform. Okay. So I'm just going to log in. So as you can see, first, there's multiple different users in this platform. Okay. And so, because it takes that level of integration with other users to be able to launch an electronic POLST. You got signers, you got family members, you got paramedics and emergency providers, etc. So I'm going to sign in. Okay, so there's me.
Can you make that a little bigger, Carlo?
Let me see if I can.
Doesn't look like it.
Let me see. So, okay, try this. How's that? Is that better? Okay. Okay, I'm going to select Mandeep, my fake patient. Okay. I am texting him right now. The reason being is because this platform requires interactions with people for dual factor authentication. Okay, and I'll explain how that works. Okay, so patients loaded up into the platform, they have their own patient profile, and then they have their own form section. Okay, so these are all the forms that we've created for Mandeep. Let me just show you how it looks. When a form is completed, it looks exactly like the California form. The platform allows us to fill out this form electronically, okay? And then I'll go over why filling it out electronically is better than using just a paper form and writing it all in. It auto-loads all the information, all the demographics once the patient information is placed in, okay? And then this would be available for uploading, printing, etc. Okay? All right. So this is how you fill out a POLST on the electronic platform, okay? So as I mentioned earlier, it auto-loads the patient information, okay? And then I could start filling out the platform, the questions, okay? As you can see, it will prevent me from selecting inconsistent answers. So it has some AI in it to make sure, and indirectly in so doing, it kind of educates a little bit just by filling out the form, okay? So that's one aspect that's much improved, because in the paper form, you could write anything down, it could be completely inconsistent, no one will be able to follow it, and then it's an invalid form. The whole purpose of the electronic POLST platform is to make sure, to increase the likelihood that the form that's being filled out is valid, and increasing it up to as close to 100% as possible. There's also clinical decision support. So this form is supposed to be viewed with the patient next to you, okay? So the provider and the patient are sitting down in the office or by the hospital bed or whatever. And so you could actually pull out an iPad and you could share this information. The language is down to, I believe, 3rd grade language, so that when you explain what resuscitation means, for example, you could literally read this to them or get familiar with this so that you could educate, so that you could help the patient understand what their decisions are in this POLST. There's also language that is, a little bit more sophisticated for providers, so they fully understand what they're helping. So the clinical decision support, again, is an educational tool, indirectly, but in a way directly, with the providers. So they're getting their own education just by using the platform, okay? So that's another key benefit that you just don't get with paper POLST. There are doctors, I've seen it, doctors filling out, they have no idea what they're doing, or I hear them, talking to patients, and the things that are saying is like, oh my God, I would never say that, or that's not exactly what that question's asking or what that form's saying. And so there's a lot of education that can occur, at least indirectly, through the use of this platform. And one of the calls to action is for us, everyone here at the Ventura County Coalition, to be so intimately aware of how this clinical decision support works, so that we can actually teach our providers, our patients, our family members what the POLST is through this platform, okay? We have embedded video. So for example, we could watch this video and we could help our patients and our loved ones watch this video to help them understand.
Let's talk about CPR.
So you can imagine, I'm going to stop this now. You can imagine that using YouTube videos to help educate, obviously these videos need to be vetted by the Ventura Coalition and probably ultimately the California Coalition. But there's a lot of good education out there that we've embedded into this platform, okay? All right, so we'll keep moving forward. So the questions here are exactly the same questions for the paper POLST, okay? And then you could type in information here. you know, I don't know, whatever you want. I'm just kind of putting things in there. Again, it has, for whenever there's a question that you know, something in the form that may need to be expanded so that patients can fully understand, like long-term artificial nutrition, there's a lot of explanation in here. Okay. Again, this is not, with a paper pulse, you're not going to get that. You're going to get maybe a provider that doesn't fully understand it, doesn't go through it with them, et cetera. And then you're going to get a, you know, maybe an imperfect, you know, possibly invalid pulse form filled out if they don't fully understand. Okay. We could upload advanced directives as well as additional information for our providers through the POLST platform. There's my name here. And then here we sign. That's what makes an iPad or a tablet really useful, is because you could sign on the tablet. Okay. And then I'm going to dummy sign this. It's as if Mandeep's sitting next to me. So, so the way that the forms are laid out is that even older forms can be viewed, but the latest form that's complete is the valid form. Okay, so if we look at the latest form, we see this is our latest form. Okay, and there's Mandeep right there.
Again, I feel like I am pounding a hammer in one place, but I do hope you will rejoin us for the next meetings and the next steps. Be looking for more information to come out on how this is going. And if you are interested, and I do encourage interest in becoming a member of the Ventura County Coalition for Compassionate Care, we would love to have you. And if you will send an inquiry, I will send you a membership profile for completion. And also know that we are looking for people who are willing to be committed to the steering committee to make this happen in a smooth and productive way. We need all the voices from this county from different sections. And I can't help but there's one person been here silent all day. Do you have any comments, Andrea? No? Okay.
I do not, other than this is tremendously exciting. And I think that we are on the cusp of really, as a county, being a true leader in this space. And if we've been doing anything in this organization for the last bunch of years, it's getting ready for this. So yeah. We really can use all of the folks that are, you know, in skilled nursing and are dealing with EMS and are part of hospital systems to help rally around this so that we can make this a reality.
Yes. Thank you. Thank you. So I'm going to end the recording. And then